Helicobacter infection stages and prevention. Helicobacter is a spiral-shaped bacteria that lives in the stomach. Helicobacter infection develops in stages, starting from entry into the stomach to serious conditions like ulcers. Stage 1, entry and colonization. When the bacteria first enters the stomach, it finds a way to survive in the very acidic environment. It does this by producing an enzyme called urease, which neutralizes the acid around it. Then, it attaches itself to the stomach lining. This happens within a few days to weeks after infection. At this point, most people have no symptoms. The best prevention at this early stage is proper hygiene, washing hands with soap, drinking clean water, and eating properly cooked food. Stage 2, acute gastritis. After a few weeks to months, the immune system reacts to the bacteria. This causes inflammation of the stomach lining, called acute gastritis. Some people may begin to feel nausea, bloating, burping, or mild stomach pain. If someone starts having repeated stomach discomfort, they should seek medical testing, usually through a simple breath test, stool test, or blood test. Early detection makes treatment easier. Stage 3, chronic gastritis. If the bacteria is not treated, the inflammation becomes long-term. This is called chronic gastritis, and it may last for many years. Some people feel indigestion, frequent pain, or sometimes no symptoms at all. At this stage, a doctor can prescribe a combination of antibiotics and acid-reducing medicine, known as triple therapy, to kill the bacteria. Following the full treatment is very important. Stage 4, peptic ulcers. After about 5 to 10 years, the bacteria weakens the stomach's protective lining. Acid burns into the tissue, creating open sores called ulcers. Now the symptoms can become serious: burning stomach pain, vomiting, and sometimes bleeding, seen as blood in vomit or black stools. Anyone with these symptoms should see a doctor immediately. Ulcers caused by H. pylori can heal completely with proper antibiotics and medication to reduce stomach acid. Stage 5, atrophic gastritis and intestinal metaplasia. If the infection continues for 10 to 20 years, the stomach lining becomes thin, a condition called atrophic gastritis. The normal stomach cells may also begin to change into intestinal-like cells, a process called intestinal metaplasia. This stage is silent but dangerous, because it is a precancerous condition. Regular medical checkups and treatment of H. pylori at earlier stages can prevent reaching this point. For people already here, doctors may recommend close monitoring with endoscopy. Stage 6, dysplasia, or precancer stage. After about 20 to 30 years, some stomach cells may begin to grow abnormally. This stage is called dysplasia, which is one step before cancer. Symptoms are often still not obvious. This stage can still be managed if detected, but prevention is far better. Treating Helicobacter infection early, before reaching here, saves lives. Stage 7, stomach cancer. Finally, after about 20 to 40 years, long-standing H. pylori infection can develop into stomach cancer, also known as gastric adenocarcinoma. Symptoms may include severe stomach pain, weight loss, poor appetite, vomiting, difficulty swallowing, or blood in vomit and stool. Cancer treatment is difficult and costly. The best way to fight it is by preventing it, through early detection and eradication of Helicobacter infection before it reaches this stage. Conclusion: how to prevent and treat Helicobacter infection. Helicobacter infection goes through stages: entry, acute gastritis, chronic gastritis, ulcers, precancerous changes, and finally stomach cancer. The journey from first infection to cancer can take decades. But the good news is, at any point before cancer, it can be treated. So, what should we do? Practice hygiene, wash hands, drink safe water, eat clean food, pay attention to symptoms, do not ignore persistent stomach pain or indigestion, seek medical care early. Simple tests can detect Helicobacter. Follow treatment fully, take the complete dose of antibiotics and stomach medicine. By acting early, we can stop Helicobacter in its tracks. prevent ulcers, and protect ourselves from stomach cancer. Don't forget to like, share, and subscribe for more videos.